Diabetes Toolkit. Go to the EMIS button, select Reporting, Population Reporting. Then choose the Lewisham CCG Search and Report folder. Select Diabetes, and this will open up the two subfolders you will need. Diabetes Toolkit. Because at the CCG we are unable to see patient level data, we have switched from the Lewisham CCG Search and Report folder to our own Lewisham CCG Only folder holding dummy patients. Now in the Diabetes Register Check folder, there are several check queries. There are 3 date check queries and 3 register check queries. The first date check query is for patients with no diabetic annual review date in the diary. This is showing one dummy patient who has no annual review date in diary. If you click on Patients Included, you will see the dummy patient, Red Mayflower. If you right-click on the patient, you can go directly to the patient record wherever you choose. The second of the date check queries is for patients with an out-of-date diabetic annual review date. In this example, there aren't any patients. If you click down onto the Definition tab, you will see how the search is made up. The first rule is looking for all patients with diabetes, and the second rule is including those patients who have an annual review date, but that date is on or before the last fiscal year, i.e. QOF year. The third check query looks for patients who do have an annual diabetic review date and diary, but whom are not on the diabetic register. In this example, there are no dummy patients that meet this search criteria. If you click on the Definition tab below, you will see how the search is made up. Rule 1 is included, but Rule 2 is excluded. If you click on the Patients Included tab, you will see that no patients have been included. The next 3 check queries are to do with the register. The first one returns all patients who have diabetes. Please note this is for all ages, unlike the QOF diabetic register. As you can see, 7 dummy patients have diabetes. If you click on the Age Sex tab, you will see that this is for all ages. If you click on the Patients Included tab, all 7 patients will be listed. The second register check query is for patients with diabetes but who are not coded as type 1 or 2. If any patients meet this search criteria, they should be reviewed and coded correctly. The last register check query is for patients who are not on the register but whose last HbA1c reading is greater than or equal to 48 millimoles per mole.